I remember I had a gentleman who came in to one of my clinics in Arizona. He had diffuse thinning throughout his entire scalp. He had probably lost 70% of his overall volume, and his vitamin D level was 3. We literally gave him 10,000 units a day. He came back and it was as if somebody had just watered the grass type of thing. It just flourished like a chia pet.
Are you tired of all those hair loss treatments and products that claim to work but don't? My name's William Gonitz, and I am your no frills, no BS certified trichologist that is going to help you understand how to tackle your hair loss and actually regrow hair.
Hey, everybody, and welcome to another episode of the Trichologist Podcast. My name is William Gonitz. I am your no frills, no BS certified trichologist and hair loss treatment practitioner. I want to introduce today Dr. Desai, a highly accomplished board-certified internal medicine physician with a deep understanding of inpatient care. Dr. Desai's extensive research encompasses quality improvement, reducing hospital-acquired infections, optimizing clinical workflow and efficiency, as well as leveraging digital health and remote patient monitoring, as well as device integration. The notable aspect of what he's been doing, among many other things, is the passionate care about integrating his clinical knowledge with innovation to shape cutting-edge technology for software solutions, as well as he is an active member of the esteemed professional societies of the Society of Hospital Medicine, the American College of Physicians, and additionally, he is the host of the Underdog Physician podcast, aimed at mentoring medical professionals and nurturing physician entrepreneurship with a highly unique ways of physicians to contribute to society. Dr. Desai, thank you so much for being here. And today we're talking about nutrition. So, let's get into it. Tell me all the things, and thank you so much for being here.
William, thank you so much for this opportunity. Thank you for the kind intro. And yeah, I'm excited to talk about nutritional deficiencies and, the role that they play in hair loss. I think one of the key emerging topics that, we are really looking at as a community, scientific community, is the role of gut dysbiosis and its role in hair loss. Gut dysbiosis for the audience really refers to just, impaired absorption of key nutrients that are essential for hair health, as well as just daily functioning. And these key nutrients, which I know we'll talk about in length, are like iron, ferritin, zinc, vitamin D, biotin, B12, folate, and, just a combination of malabsorption, also chronic inflammation that comes out of gut dysbiosis, through increased gut permeability, which can then trigger, body's natural inflammatory cytokines like IL-6, TNF-alpha, can cause damage to hair follicles and disrupt hair cycle. And then the other key aspect with gut dysbiosis is, hormonal disruption, right? So gut bacteria, influences estrogen metabolism and androgen levels. And with gut dysbiosis, you can have, DHT dominance, as studies have shown. And that can then cause something called androgenic alopecia. And lastly, with gut dysbiosis, there's also psychological stress, as well as impairment of the gut-brain axis, which can lead to mood disorders and just chronic stress, which causes elevated cortisol level that can then accelerate hair shedding potentially.
And today's podcast is brought to you by Advanced Trichology. If you are losing your hair and you are in need of trying to figure out a solution, advancedtrichology.com is where you should go and where you should start. It is the only place that actually has a full protocol for managing the underlying reason for your hair loss. And because there's only 3 reasons for hair loss, so DHT, inflammation, and nutrition, which nutrition we're going to talk about today, then you are going to be able to get an understanding of what's going on with you by going to advancedtrichology.com. And today, they're also bringing to you some of the viewer questions that we're going to talk about at the end of this podcast. So stick around so you can get all of that information. Well, you actually touched on some things. I didn't realize that there was even studies to back this up, but the gut dysbiosis aspect of increasing DHT which obviously you touched on, which is going to increase the impact of androgenetic alopecia. So why don't we get into kind of how this happens? I mean, so nowadays we've got just a plethora of, all sorts of different reasons for hair loss that are coming from lifestyle factors, which really, those reasons lead into the Gonitz trichology method of the 3 reasons for hair loss. So obviously the DHT, we've got nutrition, and then inflammation. But it sounds like what you're saying is that the underlying condition of gut dysbiosis is conceivably a compounding factor for all of those. I mean, because you mentioned DHT, you mentioned nutrition and malabsorption, and you mentioned inflammation. Right. So with that, how do these things occur? I mean, when you are just living your daily life and, you've been fine, you grew up with a full head of hair, and then all of a sudden one day you're losing hair, how does the deficiency and the underlying malabsorption gut issues, how do those start happening?
Yeah, absolutely. And I think a lot of it is attributed to our lifestyle, diet specifically. When we look at the standard American diet, there's a high consumption of processed foods, saturated fats, sugars, and, insufficient micronutrient consumption as well. Like we mentioned, William, iron plays a key role in hair health. And, I would say the standard American diet lacks, the adequate amount of iron needed, especially in people who have reduced red meat consumption, right? Proteins, vitamins, minerals deficiencies can also happen. A lot of the foods we eat, are also high glycemic index foods, right? Like simple carbs, high in sugar. These things can lead to spikes in insulin as well as androgens. And, these hormones, like we touched on, can contribute to further hair loss. Also, I think our consumption of, saturated and trans fats can also lead to elevated levels of testosterone, which, gets converted to DHT, which is a known contributor to male and female pattern baldness. So in short, I think our diet plays a huge role in, our experience and the trends we are seeing in the hair loss.
Well, and with that, and you touched on some processed foods. I mean, you feel like anywhere you go, I mean, you go and buy something at, the airport or the store, or there's
Right.
so many additives. And
Right.
I've been seeing a lot of things related to, obviously, the glyphosate that is just put on so many of our processed foods in the United States. And even when you're trying to avoid it, that it somehow, ends up in what we're consuming. And that seems to be a microbiome disruptor as well. Is that something you've noticed?
Absolutely. I think that's also, that's a huge microbiome disruptor. And, I think other things going along with diet is chronic stress. I think our lifestyle can get more and more stressful at times, right? Whether it's work, personal stress, and also what's going on right now, just with everything going on around the world, can add to a lot of stress. And stress creates a state of elevated cortisol level, which can also, cause, hair loss, hair shedding as well.
So it sounds like the world that we live in is the perfect environment
for a lot of these things. But that's why I think, William, what you have done with, the advanced trichology, right? Specifically with, the Gonitz trichology method is fantastic because, you're really addressing the root cause, which is like, nutrition deficiency, hormone component, as well as the autoimmune component, right? And I think nutrition and, the chronic stress component, I think your method takes a holistic approach to treating that.
Oh, well, thank you. Yeah, I mean, it's funny. I go back and I reflect on some of these early days of when we were trying to figure this thing out, going back to like 2002, 2003. And I remember thinking that, our basic protocol, which was low-level laser therapy, scalp massages, we were even using compounded minoxidil and retinoic acid, azelaic acid back then. Now it's mainstream, but then it was cutting edge. And I'm like, this is going to work on everybody. And then we realized really quickly that didn't work on everybody because it wasn't dealing with the root cause. So then it was slowly peeling back the onion of, what's causing all this stuff? What's causing the gut dysbiosis? What are the links? Why is itching and burning one of these things that is a symptom of somebody who, is going to have a stubborn hair loss scenario? So, I appreciate that. And, as we move through this, and you've, as a medical advisor to Advanced Trichology, have been helpful in, helping shape some of the delivery and some of the research that we're doing to even, forward new discoveries for making things more efficient, particularly in the gut microbiome. And I mean, these are some areas that we're evolving currently. But thank you. I mean, and so as we, continue to evolve as a society and really screw our bodies up, what are some of the internal deficiencies that you see showing up, specifically? Are there any blood markers? Do you see some specifics? So you mentioned iron, but is there anything else that is top of mind that ends up becoming deficient because of the gut microbiome issues?
Yeah, absolutely. I think the key ingredients that are needed for healthy hair growth, iron, ferritin, zinc, right? Vitamin D, biotin, B12, folate. Those are some of the key ingredients that are needed. And a lot of those ingredient or nutrients get deficient due to, gut dysbiosis.
And all of the things you already mentioned too with the inflammation. So, I had a client ask, why does this inflammatory state, cause so many disruptions? And I was trying to explain in an eloquent way that, I mean, the demand when you have this inflammation on nutrients, your body's trying to basically put out this fire, and you're burning higher levels of nutrients to just sort of calm things down. And you've got that little epithelial layer inside your gut that if that's disrupted because of a million different things, and all of a sudden you get this leaky gut situation, and then your body's
Exactly.
trying to get rid of these toxins, then you need even more nutrients. So it's just this downward spiral.
And also, with inflammation too, there's acute inflammation, which, usually is seen sign of like an acute injury or infection. But there's also a more silent killer, I would say, which is chronic inflammation, which you see in a lot of like autoimmune conditions, and even like diabetes. There are a lot of studies that are showing that a lot of like heart failure and diabetes, hyperlipidemia, and partially be attributed to chronic inflammation. And, that has a huge role on, hair follicles, anagen phase disruption. And, it can cause permanent hair loss too.
What are some of the conditions, you mentioned diabetes, but that you see pretty regularly that definitely are, direct violators with hair situations?
Yeah, so I think the most common one, I would say that cause, alopecia. I think there is thyroid conditions, usually that would cause, hair loss, like hyperthyroidism is something that I commonly see. Just an elevated state of TSH, which causes like hair thinning and, oftentimes diffuse hair loss. That's, I think, the most common, I would say. And then there's also a lot of, autoimmune conditions that I see, that cause like, setting of like psoriasis. I've seen that associated with hair loss often. Lupus is a chronic, autoimmune disease state that can cause permanent hair loss and, some scarring around the area as well. And then also a lot of infections like tinea, like the scalp ringworm infection of the scalp. But usually you see it more in pediatrics than adults. And then lastly, I would say in terms of deficiency, like iron deficiency, vitamin D deficiency is very common. I think it's one of the most common nutritional deficiencies I see.
Absolutely. Well, and then, being inside all the time. I mean, you at least, say 60, 70 years ago, we were not inside as much. I mean, obviously, vitamin D3 being the sun nutrient, even though it's actually a hormone, is something that, we are programmed at the moment to cover our skin and to mask the effects of UVB rays by putting on sunscreen and just making sure that we're protecting ourselves from skin cancer, which is blocking, nearly all vitamin D absorption, even sunglasses and all the rest of that. And then all of a sudden they're like, well, you need to take vitamin D to also combat cancer. So then we're taking it internally. It's very confusing. What do you feel as though the optimal levels of daily consumption of vitamin D3 are?
It really depends also on, your overall lifestyle, in terms of exposure. But I would say the recommended, right? Depending on the age group, like, if you're, under 18, usually I've seen 600, IU units per day as a recommendation. So that's like 15 micrograms. I think adults, it's also similar. Now, if you are vitamin D deficient, however, then your consumption, needs to be higher.
Yeah, really, with the advanced trichology and some of the applications that we use vitamin D for when we're testing, we typically are going to be testing the ranges, in nanograms per milliliter. And the kind of the basic algorithm that I've seen, at least for your hair, is we want your hair range of vitamin D3 for the optimal range to be around 60 to 80 nanograms per milliliter. So it's just so rare, unless someone's taking vitamin D3, that anyone's going to be in those ranges when we test their blood. And then normally I don't know if you've experienced this, but when we're applying the formula of sublingual vitamin D3 to elevate someone's D3 level, typically if you take 10 drops per day or 10,000 units per day, and you do this daily for a month, it actually moves your blood levels approximately about 10 points. So if you were 30 nanograms per milliliter last month and you've been doing this every single day, 10,000 units per day, then you'll be about 40 nanograms per milliliter this month. And that, we use that to kind of get people to that 50, 60 nanograms per milliliter range and then leave them around, 2,000 units per day. And they hold up really, really well, unless there's an additional demand on vitamin D3 that we don't know about.
I think that's another point I wanted to make is I know, advanced trichology has a sublingual vitamin D formulation, which I think is very unique. I think for a lot of, like we talked about the gut dysmotility patients, with malabsorption issues, like Crohn's, celiac, or those who undergone gastric bypass, I think sublingual delivery is the ideal route for them because it leads to quicker absorption directly into the bloodstream, right? And that's why I think you're able to see this efficacy, William, that you're mentioning, with the increases. And, the other point I wanted to make with vitamin D is, there's like different, variations, right? Like there's vitamin D deficiency, which is less than 20 nanograms. But then there's insufficiency, which is like 20 to 30. And then 30 to 50, which is where I've seen a lot of my patients, be around, which is 30 to 50 nanogram. So for them, the consumption requirements for vitamin D is much higher, right? It could be anywhere from 800 to 2,000, IUs per day.
Certainly. Well, and that's one of the, you touched on the sublingual aspect of the vitamin D3. I've seen a lot of people who they're extremely low, and their general practitioner or whomever has prescribed them the typical prescription dose, which is about 50,000 units, once weekly, and
Right,
so you
right.
take a pill. And so I found that some of those individuals who have like a low grade pancreatic enzyme insufficiency type of thing, and they just don't know it because their digestive system isn't working that well, they just don't absorb it. I mean, they can be taking
Right.
50,000 units once weekly and their levels are the same. And so that sublingual delivery is almost, mandatory in that scenario. When we see this, I mean, so people with, pancreatic enzyme insufficiency, a disturbed gut microbiota, maybe it's from issues related to antibiotics, something along those lines. What other really, key nutrient? I mean, we already talked about iron, that kind of gets really suppressed during those types of issues with, long-term antibiotic use or just general gut disturbances.
Yeah, I mean, I think that was the other thing is long-term antibiotic use, plays a huge role in hair loss as well. But I would say the other key nutrients, that can get suppressed, would be zinc, right? Would be B6, copper, would be some of those key ingredients that can potentially get suppressed.
So zinc and copper as minerals, what roles in the body do those normally play that may be, key signs of deficiency besides just hair loss?
Zinc actually is a key mediator in the immune response, besides helping with the follicle structure. So, the way zinc deficiency, manifests, it usually starts with with hair, brittle hair as well. That's usually like a key way it would manifest. And I think the other aspect of it is oftentimes, some of these minerals are not tested as frequently. So we may not know the extent of the deficiency until I guess they go to like a functional medicine specialist, perhaps, to get tested.
Yeah. And then obviously there's certain things. I mean, we went through COVID and everybody was on vitamin D3 and zinc. And if you take an abundance of zinc, then you oftentimes can then directly impact your copper because you require copper to obviously process small amounts of zinc. So if you're taking a ton of zinc, then the cofactor of copper is, diminishing some of your copper. And I've noticed, especially in the last 5 years when we really started testing heavily for it, that copper deficiency is, or I should say copper insufficiency. So the lower end of normal, really you get below, say, like 70 nanograms per milliliter. It seems to be a moderate influence on little details related to your hair, even the pigmentation of your hair. And then zinc and copper, those two seem to really help decrease the lack of melanin and or the withdrawal of melanin and support the overall structure of the keratinization. So those minerals definitely seem to be impacting things on our side when we're seeing this from our testing in the Zone 2 panel.
Exactly. And, I think the other thing is, and that's a great point about, the correlationship between zinc and copper, but, the key is, these are trace minerals, so oftentimes, they don't get tested as frequently in our panels. But like you mentioned, they play a huge role, right? And I didn't mention copper, but copper can also cause, neurologic problems, right? So sometimes numbness, weakness, in the distal extremities, pale skin. And sometimes, how copper deficiency can manifest. With zinc excess syndrome, which is, I haven't seen personally, but I've seen case reports. Usually I've seen, that zinc can interfere with, absorption of certain like medications like Lasix, or the diuretics and antibiotics. So yes, excess zinc or excess copper is not good either. You want to have that delicate balance.
Oh, for sure. Well, and just, having that balance sort of in life. I mean, we've talked about all these things that if it gets too high, then it's bad. Then these are the things that we're trying to achieve, I think, in general. But it's just so hard when we're, you're just running a million miles an hour between work and kids and all the rest of these things that our bodies are just taxed constantly. So we have to find that basic equilibrium. I also noticed that people who, they get to the end of the day, they might be consuming a glass of wine, they may be consuming sugar, something along those lines, that these sort of self-soothing daily activities can play a role as well. I mean, what are your thoughts on that?
I think wine is a part of, the Mediterranean diet. And I think wine has shown a lot of benefits, in the sense that wine is an antioxidant, like specifically red wine, right? And I think the key ingredient in red wine is resveratrol, which is a very well-known, antioxidant. So I would say that it has great impact on, anti-inflammatory and cardiovascular health. And, helps reduce oxidative stress, which can also help, with hair growth. With that said, excess alcohol, can have negative impact. So I think moderation is the key. Wine can also help with improved blood flow as well, which can help support healthy, hair follicles. I don't know if there's any direct literature connecting, the red wine or wine in general to like certain kinds of hair loss conditions. If there's any how it helps with it. So this is just my rationale.
Yeah. Well, I mean, as long as, again, we're talking about the right amount of wine.
Yeah,
So, I
exactly.
mean, I wouldn't go out and be like, oh, well, this red wine, it's going to
Antioxidants.
cure my hair loss, and just throw it back every night.
Right.
But to your point, I mean, I actually get this question quite a bit. A glass or a glass and a half of red wine per se, especially, I mean, when you're making sure that it's as clean as it can possibly be and it's, as unadulterated as possible, then I think the resveratrol, you've got, the polyphenol aspect of what's going on, all the tannins and the reds. These are good things, and they are anti-inflammatory to a level, so it's just
Exactly.
happen at some point.
Exactly.
So processed sugar, though, I mean, when we look at processed sugar, and I see people who come into the clinic, and they will oftentimes be like, "I am a sugar addict," and I'm like, well, that's not good. And I've seen that in multiple cases where I have stubborn inflammatory clients. I mean, I have one client. She's been a client for almost 20 years, and we go through this ebb and flow where she grows hair. She goes through a telogen effluvium shed. She dumps half of her hair, even though we're doing everything we possibly can to keep her hair in her head. And then she's on a series of different medications too. She'll grow it all back, and then the cycle repeats itself. But she has noticed now her medications aren't changing. She's on some thyroid meds. I think she's on cholesterol meds. She's now in her 70s. But the things that she notices when she gets stressed, she doesn't drink alcohol. She consumes massive amounts of sugar. And that has actually caused some of her telogen effluvium to be unmanageable, in my experience. And people with this, quote unquote, sugar addiction, they're actually really challenging to manage. Why would that be?
So processed sugar, I think is a challenge because I think a lot of them are have an emotional attachment, to how they feel after the consumption. And it's really the emotions behind that experience, that dopamine surge, if you will, that really drives them to make this choice of increased consumption of processed sugar. And what ends up happening is you these products have typically high glycemic index, which means they cause rapid spikes in the blood sugar level, right? And these spikes can lead to insulin production, and certainly which can then subsequently lead to insulin resistance, causing diabetes, metabolic syndrome, obesity as well. And also the other aspect of it is with high sugar consumption, it can cause chronic inflammation, which we discussed, about its role in damaging the hair follicles. And then also nutrient absorption. If you're consuming high processed sugar foods, then, the food item doesn't really have essential nutrients, like biotin and all the other stuff. So it's just essentially, starving your body of the nutrients and the minerals it needs, not just for hair growth, but just for healthy functioning. But I think it's the emotional attachment to processed sugar that's really driving the lifestyle changes, and it's hard to reverse that.
Yeah, the exact inflammatory mechanism of what is happening that impairs the actual growth of the hair in those individuals, it seems to be very specific. I wonder if there's a genetic connection or something along those lines, but it is challenging. But when they're able to bring down the overall volume of sugar, even by a third or a half, it seems to have a really positive impact on their scalp and managing situations like seborrheic dermatitis and psoriasis and these types of things. So, obviously the internal mechanisms are very interesting as well related to that.
And these days, the other thing I wanted to mention is, there are a lot of apps, in development that are already out there that actually, help consumer make informed decisions. You just scan the QR code on your phone, and it would tell you if this is good for you or bad for you, essentially.
Oh, that's great.
So that's one thing, right, to be aware, because I personally don't check the nutrition labels, but I do scan them, and the apps are developed such that I would tell you like, hey, this is, give it a ranking from 0 to 100, 100 being the best. And if it's like less than 6, he will tell you these are the reasons why, and this is why you should not take it, basically.
Another aspect of Advanced Trichology, who's sponsoring this show today, is the blood test capability. If you are in the United States and you want to test your own blood and get a full panel like what we're talking about today, a Zone 2 or Zone 3 panel is going to give you the ideal understanding of what's going on in your blood. So again, go to advancedtrichology.com, and that is going to help you understand your blood test by going and utilizing that information to go and get your blood, and then you will know exactly what your levels are so you can make the best decisions for you. Yeah, I mean, the whole app scenario, there's so many different things out there that are giving you just sort of a little bit of an advantage with technology to, enhance your ability to make good decisions. And, that's Advanced Trichology has an app that's going to be coming out here in the next 90 days or so. And a lot of those helpful things will be built into that, which is going to be pretty fun.
Awesome.
But we'll get there. I've been working on this thing for a really long time. So by the time it finally comes out, we can do a whole episode on that one.
Yeah, that'd be great, like a review.
Yeah,
a review segment.
Tell me, what do you think the optimal levels are? Of the key nutrients. You mentioned zinc, vitamin D3. We already covered kind of some of that. And, some ferritin. What are the optimal levels that you feel are what we should be looking for in blood work?
Yeah, absolutely. So the optimal levels for, like, let's say ferritin, right? I would say would be 70 to 120 nanograms per milliliter. Iron, I would say the optimal would be greater than 85 micrograms per deciliter. Vitamin D3, I know you mentioned like greater than 80 nanograms per ml would be optimal. Zinc, 70 to 120 micrograms per deciliter. B12, would be greater than 500 picograms per milliliter. B6, right, which is another important cofactor, 5 to 30 micrograms per liter. Copper, 80 to 155 micrograms per deciliter. And then folate, greater than 8 nanograms per ml. And then biotin, which is another key ingredient. To my knowledge, correct me if I'm wrong, I don't know what the optimal level for biotin is. But I was seeing like, usually the deficiency for biotin leads to like brittle or shedding of hair.
Yeah, we don't actually test for biotin since it's challenging to really kind of pinpoint generally if someone needs it or not, because again, I mean, just so many different reasons for biotin deficiency. And then there's so much of the research that basically states that, so little of the world's population is actually biotin deficient because we're getting in so many areas of our diet. So if we can correct the gut microbiome, then you oftentimes sort of allow your body to get all these key nutrients from your food, which is obviously the ideal scenario. And even vitamin D. I mean, if your liver works better, and so you're able to detoxify and you're eating cleaner, then oftentimes your vitamin D will go up just because you're metabolizing the vitamin D that you are getting in a better way. And so, yeah, typically, I mean, 60 to 80 nanograms per milliliter for vitamin D3, never to exceed 100 nanograms per milliliter. I've seen people, on vitamin D3 for 10 years, and then they come in and we do a vitamin D3 test and their vitamin D is 180. That was the highest I've ever seen. And they were having all sorts of inflammatory issues because of, once you exceed that 100 nanograms per milliliter, then you're going to get, joint pain. You're displacing calcium in different places that you shouldn't be. You're going to get, other chronic inflammation. Hair loss with too much vitamin D3 is an issue. I've seen that. You get about 120, 130, then you're dumping hair because of inflammation caused by excess vitamin D3. So balance,
Balance is the key, exactly. And we'll going along with excess, I think biotin, right, is one of those nutrients that I feel like personally, I think it may be over marketed a bit, in the hair loss industry, because I think true deficiency is rare. And, the mega dosing that we sometimes see in some of these supplements, hasn't really helped that many people. And it can sometimes interfere with other lab tests, like when you check for, thyroid tests or cardiac biomarkers. Sometimes it can skew the results for those.
100%. I mean, that's one of those things where I think ferritin is another one of those biomarkers that get thrown. So yeah, these people come in and they're like, well, I'm on, 20,000 micrograms of biotin per day. Why am I still losing hair? And then their ferritin's like, 400 and their TSH is like 0.3. And you're like, oh, what is happening? Why are you taking so much biotin? But that's what, their dermatologist told them. That's what they saw online. And then they're trying their best to do the right thing. And it just, no, I mean, we actually recommend about 5,000 micrograms per day. And that's it, because you're going to get it from other places. So, and there's other things you want to be conscious of, hyper levels of vitamin A. I mean, I get this all the time because people are using, minoxidil with vitamin A in it, or they've been on Accutane, and these things are going to create a liver toxicity. Generally, I tell people, anything in excess of 10,000 IUs per day of vitamin A is putting you at a risk factor. We know that over 25,000 IUs of vitamin D per day is going to trigger hair loss. So, use these things in moderation. And that's moderation. Again, we're keep going back to a balance. Moderation.
Yeah, balance is the key. Yeah, I mean, hypervitaminosis A, I think it's, I think it can affect the vision too.
Absolutely.
I've seen vision get affected because of it, for sure.
Well, and as we kind of go through all of this, I mean, finding out too what is your issue, because I mean, so many people like to guess, and they're going to be like, oh, you know what, I have diffuse thinning throughout my entire scalp, it must be DHT. You're like, no, it doesn't. The DHT only affects the top of the scalp. So then, maybe get some blood work. Maybe let's read your body a little bit. Maybe let's figure out some of these symptoms that we need to manage. So just, as we're getting towards some of our listener questions that we have, but, from some of the common misconceptions, we already talked about, biotin isn't necessarily something that you should just blindly take, excess amounts of. Is there anything that we've mentioned that you shouldn't do or should do that are common misconceptions that you find in this gut realm or nutritional realm that the listeners should know about?
Yeah, I think one of the key aspect is, when we talked about the lab ranges, there's like a normal blood work, right? Which we would, look at based on like population averages. But then there's optimal level. And that optimal level is personalized to each individual. And I think that's where, with what you do with the Guanus trichology method comes into play, because, we need to be able to look at these levels, not from the context of whether it's normal or not based on the population averages and the ranges we look at, but is it optimal for you? And I think that's the kind of questions that, patients should be asking their providers, or is it just when they're reviewing the report to see, okay, is this level optimal for me? Because everyone has different stresses, different conditions, and interplay of all of those things in conjunction with the environment that they live in, dictates, what level is optimal for them. So I think that's another key point, I wanted to make with respect to misconceptions.
Well, and when you see somebody who's treating a particular situation, we've talked about a couple of different nutrients, but I know we really focus on vitamin D3 and ferritin specifically for your hair. And let's say you get some blood work, and then you're starting to treat yourself using, vitamin D3 or iron to build up your ferritin. How often should we retest?
That's a good question. I would say retesting on average, typically we tend to do, in the case of like thyroid or other conditions, I tend to do it every 3 months. But in the case of like nutritional deficiencies, I take at least 6 months, because, it takes a while for your body to recuperate and have adequate storage, in place. So I tend to do 6 months or in 6 month intervals.
Okay. And I mean, realistically, when we're looking for those exact labs, I mean, what do you, if a individual is looking to get some lab work from their primary care, I've heard a lot of people get pushback because they might be asking for some of the things that we've talked about, a full nutritional panel. And then the provider is saying, oh, well, you don't need that. What are some ways to kind of help, gently nudge your provider into actually getting the right blood test for your hair?
Yeah, absolutely. And I think and to answer that question also, the key labs, I would say that, the listeners who are interested in, being having a proactive approach to their hair growth journey, should request like ferritin, a full iron panel, vitamin D3, B12 and folate, zinc, copper, thyroid panel, CBC, CRP, homocysteine level, testosterone, DHEA, and possibly DHT. And the way to approach, a lot of these blood work is, some of these are trace minerals. So it's commonly not tested for in our regular standard panels, that we use. So I would say, I think the key really is, a lot of functional medicine providers, who specialize in like holistic approach, are likely to order, have more experience with some of these minerals, and what to do about it. So I would say really approaching, a functional medicine specialist or even a regular, physician, and just explaining them your rationale for why you want to order it, what you want to do with the, test results, because perhaps they may not directly be addressing the hair loss because it may be out of their scope of practice. But just explaining to them, what the rationale is and what you want to do with the results, right? Which other provider you want to see, who may not be able to order the blood work, I think goes a long way. And certainly, functional medicine, holistic providers are always willing to order these blood tests.
Certainly. Well, and that's why we have, I mean, basically almost everything that you mentioned is in the Zone 2 and Zone 3 panel that we have for advanced trichology, which you can actually just order on our website and then, go to a Quest near you and get that blood work, which, it's just hard because, I mean, I found that some people had to lie to their general practitioners and say, hey, you know what, I have anemia, or I think I have anemia because I'm, bruising easily, or I'm fatigued. And, fatigue can go along with some of those items that are related, low vitamin D and iron. But it shouldn't be that way. I mean, you shouldn't have to like fudge something to your GP to be like, can you
Right.
give me the
To
blood
get
work
some blood work.
to help me grow my hair back? But, sadly, that's just kind of how it is sometimes.
Yeah. And the other thing is, I don't know if the trace minerals are sometimes may not be covered by insurance as well. I'm suspecting, perhaps. And I know a lot of the functional medicine practices, I know the patients, pay to order the blood work panel.
Oh, for
Even they
sure.
order online. So I think maybe that might be the reason too.
Yeah, and that is definitely, I mean, I know, a lot of my clients, the reason that they choose to run the panel through us is that they can't get it through their practitioner for insurance purposes, because alopecia as a whole is not considered a medical condition because, why would insurance want to help you with your hair? So that's just the way that it is. But I mean, we've covered so much great stuff talking about obviously the gut microbiome and all the deficiencies that could lead into it. It's all part of the nutritional hair loss portion of the Ghana's trichology method. And, for really dealing with that, I got to give a shout out to Advanced Trichology, so that if you're dealing with these nutritional issues, you can obviously go to Advanced Trichology and run through a full Zone 2 or Zone 3 panel. You can actually go and dial in those individual specific idiosyncrasies of managing those nutritional aspects through Advanced Trichology as well. So obviously check out Advanced Trichology at advancedtrichology.com. And we've got a list of interesting questions that we can get to now from the podcast audience. And I'd love to get your answers on these. So this one is related to vitamin D3. It says, Doc, my vitamin D3 level is 19. I have female pattern hair loss and thinning. What dose of vitamin D should I take and for how long?
So I think a level of 19 is definitely deficient. So, my advice would be continue following up your levels, but I would say at least I'll recommend taking, 2 to 5,000 IUs of vitamin D3 per day. And then, maybe they can retest it in 3 months, but that is deficient, and I've seen levels as low as under 5, which is extremely low. And in those cases, we need aggressive repletion, so possibly in the range of like 10 to 50,000, IUs we're talking about, per week.
I mean, on that same note, I remember I had a gentleman who came in to one of my clinics in Arizona, and I met with him personally, and he was probably 22, 23 years old. Literally, he had diffuse thinning throughout his entire scalp. And the only issue that I could find, I mean, he had probably lost 70% of his overall volume. And
Oh, wow.
the only issue that we could find was vitamin D. And his vitamin D level was 3. So it was 3 nanograms per
Oh,
milliliter.
wow.
And so we literally gave him 10,000 units a day for like 90 days. And he came back, and it was as if somebody had just like, watered the grass type of thing. It was like,
Wow.
when it came in, it was all just, sad and had diminished and retracted volume and width and diameter. And then it just flourished like a chia pet. And that was it. That's all he needed. So it was like, to your point, definitely a vitamin C.
I think aggressive repletion usually works, as long as you don't have any malabsorption issues. I think with a lot of these levels, that are super low, I think it definitely does wonders.
Absolutely. So we've got this one. So I've had my entire body checked. The doctor told me I have a vitamin D3 deficiency. What is vitamin D3 and how can I avoid the deficiency? I think we've covered some of that, but maybe just specifically for this listener.
Yeah, absolutely. Vitamin D3 is an essential nutrient. We call it cholecalciferol. That's the vitamin D. This is vitamin D3. That's absorbed from sunlight and is just an important mediator. Has so many different functions. That it takes part in, right? Like muscle function, immune function, bone health. Helps with calcium, and it's really the key with vitamin D3 is helps with calcium absorption of the gut. And I would say the ideal daily intake if you don't have deficiency, is 400 to 800, international units per day. But that could vary based on like the age, the race, the season, the sun exposure, clothing. A lot of those things play a key role in what levels would be optimal for you.
Okay, so this one's about B12. So, hello, sir. I'm a 21-year-old boy. For the last 6 months, I've been experiencing hair fall. My B12 is 103 picograms per milliliter. The dermatologist recommended 5% minoxidil and said after 6 months, I can stop using it. I mean, in that regard, what would you tell him about his B12 level?
So the B12 is very low. So I usually, would recommend, consulting, of course, with the primary care provider, but, possibly they may need injections, once a week injection or high dose oral supplement. I would recommend the injection route because the B12 reserve takes a while for it to, replete. But they can continue the minoxidil, but I think the B12, they need, I would recommend an injection, for it.
Absolutely. Well, and then on top of that, don't stop the minoxidil. Once you start,
Yeah.
I mean, if you're on topical
Yeah, you'll
minoxidil
regress.
more than like 90 days, don't stop because that's
Right.
a whole problem. That's on another episode of the podcast.
Yeah.
This is an interesting one. My ferritin is overly high and my seborrheic dermatitis is flaring after a major surgery in February. Will this affect my hair? I think this is a great question for high ferritin and its relationship to, inflammation.
Yeah, I mean, so ferritin itself, it's essentially a protein, right, that stores iron in the body. And it's typically released, when it's needed, right, to maintain like iron homeostasis. And inflammation can like severe dermatitis or just chronic inflammation can activate this ferritin, which serves as an acute phase reactant. So I would say yes, high ferritin, in excess, you know, would not be would definitely affect the hair growth.
Yeah, and in my experience, seborrheic dermatitis after a surgery, the trauma itself can create a flare as it's an autoimmune, and then that needs to be managed, and that's a whole beast with that type of condition. So this has been absolutely phenomenal. I really, really appreciate you being on the show. Additionally, if you want to go check out Dr. Desai, we're going to obviously have all of his information in the show notes, but definitely check out the Underdog Physician podcast because he has got his own podcast, so you can listen to him there. And again, thank you so much for being here. I hope you have a wonderful day at the hospital, and we'll probably talk really soon.
Awesome. Well, pleasure, to come on the podcast. Thank you for this opportunity. Hope I gave some good insights. I'm excited to continue to share my expertise and my knowledge.
Absolutely. Thank you so much.
Thank you.